Dr. Sultan Holt is enjoying work once again. He spent 10 years as an anesthesiologist at a Budapest hospital, but he says the long hours, poor conditions, and low pay took a toll on his health. He felt burnt out, so he decided to move to Germany.
Every morning, I wondered if I could save lives. The stress got so bad that I had to take a mix of 4 blood pressure pills just to function.
Dr. Holt is not alone. Over the past decade, about 8,500 doctors and nurses have left Hungary looking for better pay and working conditions. That's left the country's healthcare system understaffed and led to longer waiting times for patients.
Most doctors in this country don't have the luxury of regular hours or weekends off. Many of us work extra shifts to make ends meet, sacrificing our free time. The stress during work hours is tough, and it's pushing a lot of nurses and doctors to leave the country or switch careers altogether.
The government raised salaries by 11% in January. Now the average monthly salary for a general practitioner is $6,200. But doctors still feel overwhelmed by their workload, saying that they have more patients and fewer resources. Right now, Hungary has only 33,000 doctors, serving a population of 9.7 million people, which translates to 3.5 doctors per 1,000 inhabitants, the lowest ratio among EU countries. Dr. István Kormedy is Budapest's oldest general practitioner. At almost 101 years old, he says the shortage of doctors in public healthcare means many work way past the retirement age.
There's a long wait for medical care, especially for surgeries like hip replacements, which can leave people in a lot of pain and unable to move. Some people turn to private care for quicker treatment, but it's expensive. As more people switch to private care, the wait times there get longer too.
Since leaving Hungary, Dr. Holt hasn't looked back. He says he is facing fewer financial pressures and continuing to do life-saving work.
The working conditions in Germany are much better. I work in a heart hospital specialising in cardiac surgery. Within 3 years there, I became a chief physician.
According to Dr. Holt, the hemorrhage of doctors in Hungary won't stop until the root causes of the healthcare crisis are healed. Pablo Gutierrez, CGTN, Budapest.